Okay, so welcome everyone. We've got some people still trickling in to the room, so we'll give it maybe a minute and then we'll get started. And for those who are kind of wondering what session they popped into, this is the Papers to Practice session. And then it links into the Working Group 1 on Capacity Development session. Okay. I think it's 2:01, so we'll get started, and I know others will continue to come in, but they won't miss much at the very beginning here. So welcome everyone. Good morning, good afternoon, good evening. For me, it's morning, so apologize, my voice is still waking up. Before we get started, kind of wanted to go over some of the housekeeping. I'm sure everyone's already seen this as of yesterday's plenary and other sessions, but this is a session that's being recorded. So if that's something that you feel uncomfortable with, unfortunately, we will keep recording. So if you do feel uncomfortable, you'll have to leave. We will have an interactive portion of this session. So at least for the time being, videos will be off, but once we get into breakout rooms and discussion, they can come back on. But please keep your microphone muted at all times, just because it can be disruptive to those that are presenting or speaking. And then if you, feel free to use the chat, it's there. Say hi to everybody, introduce yourselves. It's really lovely to see and get to know everybody who's here. And then just kind of a reminder, these are 90-minute sessions. Please take care of yourself as you need. And we will have a little break as we transition into the second part of the session. All right. So as I mentioned, this is the Papers to Practice and then Working Group 1 Capacity Development session. We'll start with Papers to Practice, and then, as I mentioned, we'll have a bit of a break, and then we'll go into the Working Group 1 meeting for Capacity Development. And anybody who can wants to stay can stay, but also feel free if you're wanting to leave and you're only here for one part to take your leave. So Papers to Practice. It's been an effort over the last several months, working very closely with Dorothy Spuler from AAVOG to find a way to bridge the gap between research and practice in a way that makes research accessible to busy practitioners and professionals. And for me personally, this kind of started with a number of personal conversations about there's got to be a better way to present research than just in papers. I mean, obviously the papers are there, but how do we make sure that this relevant information is put to practice? And some of the things that I wanted just to kind of point out, and these came from studies that were not intended for papers, to inform this work with Papers to Practice, came out of some of these surveys that were done over the last years. One of them was actually a knowledge management study that was done for SuSanA. And we had asked individuals and organizations how they build their knowledge in sanitation. And, reports, papers, books, these came out on the top. But at the same time, we also know that there's a lot of information to sort through, and time is of essence. People don't have endless hours in their day. So that was kind of one learning. But when talking to other stakeholders, and in this particular survey, we were speaking with private sector sanitation actors, we also learned that reading isn't everyone's top way. It's not their preference for learning. And so this, again, what can you do to, again, bring that knowledge that's coming out of academia, out of these publications, and put it to practice. And so that's what kind of brought us, Dorothy and I, to the birth of this this concept, and it's actually a podcast. So today we're going to introduce it. It's not officially launched, but this is just to introduce the podcast itself. Each podcast or each episode, it will be between 20 and 25 minutes, and they'll occur monthly. And each episode will cover one publication in an interview format with one or more of the authors. And during these sessions, we will be asking professionals, practitioners, especially those that are the intended audience for that paper, their thoughts directly, like what, in terms of the application, but also in terms of their understanding. The goal, even though we're still getting this started, is to have rotating interviewers so that we have as many voices part of these podcasts as possible. I know that both Dorothy and I can say that we know you would get sick of our voices. So we want it to be inclusive and engaging with others that are interested. And currently, SuSanA does have now a filter for podcasts in their library. So that's one place where you'll be able to find these episodes associated with each of the papers, but also they'll be available on other platforms. And the hope is to launch the actual episodes in September or early October of this year. So if you are interested in getting involved with the actual production of episodes in any way, whether it's, interest in submitting a paper or being an interviewer, getting involved in any other way, please email myself or Dorothy. And for today, we would like to give you a taste of the structure of these interviews. And we're fortunate enough to have some guest authors here with us. So without further ado, I want to introduce Papers to Practice. And here we go. Oops, nope, that didn't work. Let's try that again.
This is Papers to Practice, a series where we take important sanitation publications and break them down in 20 minutes. We ask the author directly who should know about the publication or research, and what are the key points so that professionals and practitioners working in sanitation can put these papers to practice.
So that's just a little taste of the actual episodes. And we already have one that's completely recorded. But today, this particular episode is, the paper is the SaniPath Exposure Assessment Tool, a quantitative approach for assessing exposure to fecal contamination through multiple pathways in low resource urban settlements. And with that, I'm going to stop sharing my screen. Oops, sorry. And I want to be able to welcome our guest authors. So today I will be the interviewer for this particular session. And we have two guests with us today. We have Atto Sanea and Suraja Raj. Atto is currently a project coordinator with Trend. He has over 7 years of experience in development planning, research, and community development in Ghana and across Africa. He recently supported the development of the National Liquid Waste Management Strategy for Ghana and the Solid Waste Management Improvement Plan for the Greater Accra Metropolitan Area. And he's part of the team in Africa mainstreaming SaniPath. And Suraja is an associate director for research projects at the Center for Global Safe Water, Sanitation and Hygiene at Emory University. She has been with SaniPath for 8 years, and during that time has led the development of the SaniPath platform and tool. She has trained on and managed field teams using SaniPath in both Sub-Saharan Africa and Asia. And prior to SaniPath, Suraja worked in areas of neglected tropical disease, One Health, diabetes, and nutrition. So welcome, Suraja and Atto. We're really happy to have you both here today. and be the guinea pigs for us in this first live session. Why don't you each tell us just a bit more about yourself and your interest in this work?
Sure. Thanks, Laura. As Laura mentioned, my name is Suraja, and I'm at the Center for Global Safe Wash at Emory. And I've been coordinating research and dissemination activities for the SaniPath study, which is a Gates-funded study that's been ongoing since 2011. And a big part of my role on the team has been leading the development of the SaniPath tool, which is a rapid fecal exposure assessment for decision makers in low-income urban environments. And personally, this has really interested me because, as this podcast is about, I'm really interested in bridging that gap between research and practice. And this podcast really resonates with both me, but also the whole philosophy behind creating the SaniPath tool.
Great, thank you. Atto.
All right, thank you again. Thanks, Laura, for having me. So my name is Atto, and I work with Trend Group in Ghana. My work as a project coordinator revolves around using various qualitative and quantitative approaches to generate relevant data to support project design and programming in Ghana and in some countries in Africa. So my recent work has been supporting the development of the SaniPath methodology, and also particularly mainstreaming this SaniPath methodology and introducing that to other countries in Africa, and also doing some work with the tool in Ghana as well. Thank you.
Great, thank you. We're happy to have you. And I think in terms of connection, we can still hear you, but we might have to turn off our cameras. I'll give you guys both the heads up if it remains kind of choppy. But so I guess for this particular paper, it would be great to hear kind of who it's intended for. Like if you were to recommend it, who should read it and who should know about this research?
Yeah, so the primary audience of this work and this paper are local municipal governments, water and sanitation utilities, could be development banks or funders who are making the investments in sanitations, or other organizations, nonprofits working in sanitation at a local level. And I think it's useful for anyone who doesn't currently have public health data to guide their decision-making process and would like a standardized approach to collect such data.
So from kind of going from the audience, I want to segue into kind of the part of the show or this podcast where we talk about the paper itself. So this is the part of the show where we're going to ask you to kind of break down the research and tell us what we would need to know as practitioners and professionals working in sanitation. And pardon the pun, in essence, the author will be demystifying sanitation research so we can put it to use. In the actual podcast, to make it interesting, we actually ask external reviewers to review and ask questions, but here we'll be asking everybody who's present in the session today to ask their questions directly, and hopefully we'll have enough time, because I think that will be a really great, interesting dialogue later in this session. But whenever a concept is too complex, I know one of the challenges with research is jargon. So whenever a word is too complex, a concept too complex, the idea is to kind of stop both of you and revisit it and re-explain it in a way that is easy to understand for anybody who is listening. So you'll have harder interruptions, but you'll also have been warned that that would be happening. So let's get started. So just to start, Suraja, tell us about SaniPath and the methodology.
Yeah, so really our impetus to create this tool stems from the idea of environmental exposure pathways. So what do I mean by that? Well, in an urban environment, especially one with poor fecal sludge management, there are many different ways one could be exposed to fecal contamination in the environment. And that's what we call in this paper environmental pathways. And those are these compartments or reservoirs of contamination. They can include things like drinking water, bathing water, surface waters like rivers or from oceans, open drains, raw produce, street food, and even things like public toilets or shared latrines. So they can be spaces where you might ingest contamination, or you might have contact with surface where you would have indirect contact with the contamination. And so how often you interact with these pathways and the level of contamination them is what contributes to an individual's risk of exposure. And so we realized that there isn't a lot of evidence about these exposure risks. And most of the time when we do have information about public health risk, it's focused on one or two pathways, maybe drinking water or the public latrines. But the thing is, not all pathways are created equal. That is to say, if you're living in an environment exposed to all of these different pathways, some of them are going to contribute to your risk more than others. And if we want to effectively lower that risk and subsequently any potential infections or health outcomes, you're going to want to be most effective by addressing those pathways that are dominant. And in the paper, we describe dominant pathways as pathways that contribute most to this total exposure. So based on our experiences conducting an in-depth assessment in Accra, Ghana, which you can read about in one of our other publications, we distill down these methods for risk assessment to a simpler and standardized approach to generating exposure data. So we designed the SaniPath tool to assess risks to poor sanitation and to help prioritize sanitation investments based on the exposures that have the greatest public health impact. And this paper describes both our rationale as well as the methodology for doing that. Our tool provides guidance for a standardized primary data collection exercise at the neighborhood level. So that includes conducting key informant interviews and transit walks within a community to help contextualize assessment, and guidance for collecting behavioral data in the form of household, school, and community surveys about how frequently people are coming into contact with these environmental pathways I'm talking about. And then for each of those pathways, we also provide guidance for collecting environmental samples. So collecting samples from each of these pathways, whether it be street food, ocean water or surface waters, again, drinking water, etc., and then testing them using basic microbiological methods that most water testing labs would have the capacity to conduct. And to help users in this exercise, we built a cloud-based platform to help users in managing this process. So a user can create an account at tool.sanipath.org, answer a few questions to customize their assessment, and from there, they can download mobile forms for data collection, monitor data in real time, automate the exposure assessment analysis, which combines the behavioral data and the environmental data with other parameters, and visualize the results in a way that's accessible and understandable to people with a variety of backgrounds. So it really enables you to be able to do this sort of exposure assessment without necessarily having advanced risk assessment or statistical knowledge, and trying to lower the barrier to doing that. And made these visualizations easy to make comparisons across these environmental pathways, across populations, for example, adults in the community versus children, and also across neighborhoods within a city.
That's great. And I know, Atta, you have worked very closely with this in Ghana and now in other countries. Can you speak a bit more to how it was applied in Ghana specifically, and how you're working to mainstream the tool in Africa?
All right, thank you, Laura. I think my colleague Suraja has given a good picture of how the tool operates. Yes, in our work in Ghana, I would want to start by saying that poor fecal sludge management has been one of the biggest challenges of most cities in Africa, and Ghana is having similar challenges. And what has been very crucial about this problem is that most city authorities, city managers, and policymakers lack the critical data that informs them about a very vivid picture of what the problem is and how or what extent it reveals itself and how to respond to that. So this tool offers a good understanding of the extent of the problem with fecal sludge management and how this problem leads to contamination of various elements within our environment. So city authorities need to plan. City authorities need to take investment decisions on sanitation. And it's very important that these decisions are backed with good data that has reference. So that is how the tool has been useful in this dimension of our work. So in our work in Ghana, we're trying to introduce this tool to various city managers, and this is the strategy of our operation. We normally would do awareness creation about what the tool offers, the kind of data it offers, the kind of opportunities that city authorities and planners have by using this tool to decide on what to invest in. And in doing that, we speak to a whole range of stakeholders. So community groups, we talk to city managers themselves, we talk to politicians who are in charge of data, we talk to utility companies and various service actors to let them understand what kind of data we could generate using this tool. Through this awareness creation, we kind of also give them understanding of what this exposure thinking is about and what the various pathways, because most often for us in Ghana, for instance, a lot of investment coming and we are constructing toilets. But then we realize that there are multiple ways in which public health is being impacted. So this tool kind of give a realization of what this, the multiple ways in which our public health is being impacted. We also support these local authorities to train their staff to use the tool. So we train people to use the tool. So it's not like we go in and try to deploy the tool by ourselves. So we are training various local authorities, municipalities to use the tool. We also, through the tool, the result that is generated, we guide them because the result is supposed to give you support to decide or take decision to plan. So what we call results to action. So based on the result, how do we act? Yeah, so and also we support with policy, influencing policy. I want to cite a few examples of how we have implemented the results to action. So in Ghana, in one of our cities, Kumasi, we deployed the tool and the tool revealed that there is the water, people who fetch water from public standpipes, the water samples that were collected were contaminated. So through this, we're able to engage the utility company, the Ghana Water Company, and through our engagement, there's a whole massive agenda to implement water safety planning at the urban level and some peri-urban areas to improve along the chain how water service is being delivered safely. Again, one interesting outcome of the work is especially on street food and raw produce. Often, when we talk about sanitation and poor fecal sludge management, nobody will talk about food because we don't see the direct linkage. But we found out that because of poor fecal sludge management, streets, food that is being sold on the street are contaminated. And in Accra, for instance, urban agriculture is happening in areas that are maybe marginal lands, I would say, areas with poor water supply and sometimes drains and where they are releasing effluents and all that. So these lands that are available for people to use for urban agriculture, we found that the raw produce that have a huge market of more than 2 million people in Accra were mostly contaminated, entirely contaminated, and realized that in both rich areas and low-income areas, these vegetables were being consumed. So when you talk to the policymakers and the city authorities, and they realize that along this particular element, we are both affected, whether if you live in a rich neighborhood or a low-income neighborhood. So there was a need to, then the whole discussion was how can we ensure that we improve food safety? And so we also had, through this engagement, spoke to other stakeholders like the Food and Drugs Authority in Ghana to begin to discuss what kind of things can be put in place to improve food safety. So it tells you that it takes away the conversation around just let's construct toilet, let's put in treatment plant to cut the contamination, but then you realize that there could be other elements, and the tool is able to point you to various directions so that you can really direct your investment. And also a particular example, in our work in Zambia, after the deployment of the tool, one of the area that showed high levels of contamination was shallow wells that were being used in mostly low-income communities. And it was the main reason for high cholera in Zambia at that time. And directly, since the result was pointing us to that direction, the city authority took an action to bury all shallow wells. And that's led to the end of cholera for that particular season. So it tells you how quick the result can influence action, and it also tells you how it can even influence an overall policy direction in terms of food safety, in terms of water safety planning. It also gives direction on how you need to increase investment in sanitation facilities and infrastructure. So that is how useful we've used this tool, and we've been, maybe later I'll talk a bit about our work as a training hub. Thank you so much, Laura.
Thank you, Ato. And I know, Suraja, you talked a little bit on the methodology itself, but can you tell us a bit about kind of the user experience with this tool? Obviously, the gathering of the evidence is crucial for this decision-making and even policies, as you mentioned, Ato. But if someone did want to, investigate further SaniPath and wanted an idea of what it actually takes in terms of time and cost, can you speak a bit to kind of, what that looks like to put SaniPath into practice?
Yeah, sure. So we actually have gathered a lot of resources over the years to help facilitate the process of independently conducting a SaniPath assessment. And all of this can be found on our website, which I know will be shared after the podcast. And we have YouTube tutorials, we have protocols, and we also have planning tools. So to kind of get to your point about like what is needed to do this, some of the basic requirements are access to a microbiology lab. So we have a couple different approved methods that can be used. And in our experiences, a lot of labs that do basic water testing would be able to handle the work that is required of the SaniPath testing as well. And then the ability and staff to conduct that testing as well as do the surveys. So that's household surveys, which are going to door to door and interviewing people, as well as surveys within a school and in community groups. So really the majority of sort of the resource that's needed is the personnel time. So, if you have staff already for some other projects, it's easy to sort of leverage existing staff to do this. The more staff you are, you can do an assessment more quickly. But in our experience, for about one community within a city, it would take about 2 weeks. So if you're doing more communities, you can kind of just multiply that out. And as far as cost, again, sort of the main driver of the cost is personnel time. So we found that there is a lot of variation on what it costs to pay people, depending on where you are in the world. But that is, if you have existing staff, again, that cost can be sort of lowered. Also working with existing environmental health officers, we've seen that happen in several municipalities, sort of building the capacity of environmental health officers to conduct these assessments. And then there is the cost of some supplies for doing the sample collection and lab work. So it can vary the cost from context to context, but we've really tried to sort of balance the sort of keeping things simple enough that it can be conducted in a relatively quick manner, and also for relatively less resources, or having a couple options for how things can be done, but still provide meaningful information that involves primary data collection.
Thank you. I know we're going to be coming up on time, but I want to make sure that we open it up for some questions. Again, in the actual episodes for the podcast, we will be kind of engaging, different professionals and practitioners for the attended audience, or from that intended audience group, to ask those of the authors directly. But here we have the pleasure of everyone in the room. So if you do have any questions for either Suraja or Atto, feel free to throw them in the chat, or you can use the raise the hand function. I think due to time, we probably only have time for 1 to 2 questions. Does anybody have anything that they would like to be asking at this moment? While maybe everyone thinks of their questions, I don't know, Atto, is there anything else that you would like to add in terms of kind of the user experience? You had mentioned training as well, and Suraja, you mentioned that, but and the experience of doing that for other countries across Africa.
Thank you, Laura. So yes, like I mentioned, one important thing I want to maybe take across is the fact that the tool is easy to use. Like Sarah mentioned, there are enough tutorials and enough manuals and guidelines in the use of the tool. So, and in each context, like I mentioned, we've done this in Senegal, Zambia, Uganda, and in Ghana, and currently there have been some work in South Africa as well. In every context, you try to understand the context and see what materials are easy to get here and how do we work the way. But there are standard methods, but in every context, you try to customize the context, and it is easy to use. You don't need highly qualified people to be able to understand how to implement the tool. And that's one very good characteristic about the tool. It's also very easy in terms of even the laboratory work that is required. Any minimum biological lab will be able to operate the various biological analysis that are required here. One good thing I also want to add is that the tool is very complementary to a lot of tools existing in the sector and other whatever project you are doing, because for example, even for other people in the city, let's say for planning work, for water resource management, whatever work you are doing, the tool will be able to complement what you are doing. So the complementarity of the tool is very good. For example, we try to sometimes combine some of the feedback we get from this with sheet flow diagrams and all that. So there are various ways you could, and even all the approaches that are being implemented, advanced CLTS, inclusive citywide sanitation. This tool is very complementary in whatever approach you are using, whatever work you are doing. So far as within the water sanitation sector, it could generate some data that could be very complementary to what we are doing. What is nice is also that it gives information about different spatial skills, let me say, spatial skills. It could give you information about a particular unit. In the case of Ghana, we did a work where it pointed us to a particular river where effluent was being released into. Meanwhile, low-income communities around that area were using that water for domestic things. So it was causing problem to their public health. So we could go point to a particular area and take intervention. It could also give us an impression of what is happening in a whole neighborhood. Yeah, so if I say it gives you information about different skills, yeah, so it's really helpful, and you can now have a more customized intervention based on the kind of result that you can get. Yeah, so that's what I wanted to add about this.
Great. It looks like we have.
Laura, oh, sorry, just really quickly. I just wanted to chime in and kind of going back to this idea of what was, the resources needed for conducting a SaniPath tool. I meant to add that the average sort of cost of a deployment is between $2,000 and $4,000 US in a community, depending on the cost of personnel and supplies. So just to give something a little bit more tangible for people to think about when thinking about the resources needed for this.
Great, thank you. Yeah, it looks like we do have a couple questions in the chat.
Great.
So we'll start with one and we'll see where we land, because I know we're getting close on time. But Dorothy, do you mind reading?
Yeah. So this question is from Vishwanath, and it's to Suraja. So E. coli and fecal coliforms have been the standard indicator bacteria usually tested. Salmonella, Giardia, or others. Is there a set you would recommend to check for in soil, food, and water for especially diarrheal incidences?
Thanks for that question. So our approach uses E. coli as the fecal indicator, and the main reason we recommend E. coli for our assessment is because of the ease of testing it. Testing things like Salmonella, Giardia, et cetera, involve more advanced lab methods and assays, and we have had partners who have used PCR methods to detect them. And we encourage those who do have that capacity to do additional testing. But because we wanted to make this process accessible to groups that might not otherwise have collected public health data and, again, lower that barrier, we've been recommending E. coli for this risk assessment. And all of our analysis, all of those pieces are using the E. coli data to conduct the exposure estimates.
And Dorothy, you said there was one more, correct?
So there is another question to both of you, actually. And the question is, in this paper, you list a number and you suggest to test the number of exposure pathways. So is there a chance that there are any other pathways which are might not covered by the tool, or during the development of the tool, have you been able to discover new exposure pathways that haven't been explored before?
Yeah, so I guess I can start, and then Ato, if you have anything to add, please jump in. So yeah, so this tool has gone through many iterations. So in the paper, we describe some validation exercises we've done to see how replicable the results are, as well as compared to in-depth exposure assessments. And with all this information, as it's been used and piloted in different sites, we've refined the tool. So we have added pathways over the years. And yes, at times there are pathways that are not considered in the sort of basic number of pathways that are recommended from the SaniPath tool. In our experience, they do sort of tend to be similar to one of the other pathways. So for example, there might be another drinking water source. And so we have made it possible to customize the forms and add a pathway if needed. So there is a level of customization. If it's similar to an existing pathway, we can work with, it fits into the analysis process. And for cases, which we haven't had that many of, but for cases where there are totally new pathways and things, we have always been happy to work with users of the tool to try and find a way to see if they can collect some data that can help inform their idea of risk in their communities, and help them figure out what would be the appropriate steps forward.
All right, so what I want to add is that I think for the various pathways, they are selected, the 10 pathways are selected because these are pathways that are within the public domain or have a dominant impact on the public health of a population. So if you look at, for example, municipal water, if there is some impact on municipal water, it has the propensity of affecting a larger population. If you have, let's say, street food, it's open in the public, anybody could have access to it. So yeah, if you look at public shared facilities or public toilets, people within the public domain use these facilities. And for example, if you come to cities like Accra, where about almost close to 45% of the households depend on these facilities, it's very opened up to the public. So that has been one of the, and when you visit in our practice or use of the tool, or visit communities, we discuss with stakeholders, we introduce them to these things, and we discuss what are the likely pathways that exist and could impact on their public health. Yeah, so, and like Suraja mentioned, in any area where we found something that needs to be added on, or something they consider has risks, we discuss and we can add on, because the tool allows to customize the forms to add on anything that is considered risk. Yeah, but mostly we select pathways that has a propensity of affecting the larger population within the city. Thank you.
Okay, so we are very close to time, so I'm going to have you guys. And the final question, I originally had asked you to kind of share what are your top 3 takeaways for, decision makers, NGOs. Yesterday we were chatting, you mentioned funders as well. But because of time, I'm going to say from both of you, what is maybe the top takeaway from each of you? I'm going to make it trickier. That if you wanted to point someone to this paper, they should know, or if you're pointing them to SaniPath, they would need to know.
Okay, so my top takeaway would be that by understanding the relative importance of multiple exposure pathways, sanitation interventions can be tailored to address those pathways with the greatest potential for public health impact. Today our SaniPath tool has been used in 11 cities and county and counting across sub-Saharan Africa and Asia. And this is really encouraging because as others continue to collect some information, that's more information that we can draw on for such investments. So I really think if you walk away with anything, it's just that there is a value to understanding about what's happening across these multiple different pathways, and that can help tailor your investments.
Atto.
Yeah, I think the major takeaway for me would be that more importantly, in areas like the global south, where resources are very scarce and we have limited opportunity to invest in sanitation, there's a need for us to back our decision by evidence. And that's what SaniPath does. It gives you evidence that guides you to decide on where to put your resources. Because we normally would jump into the usual things, increased construction of toilets and all that. But then we remember that then we will miss out on shallow wells, we'll miss out on street food, we'll miss out on raw produce, we'll miss out on public standpipes. And these all have impact on public health. So it's important that we focus on the evidence before we decide on where to invest. Thank you.
Thank you both. I want to thank both of you for being here today, and again, being the kind of guinea pig for this live episode of Papers to Practice. We hope that everyone found it interesting, and you stay tuned for when we actually launch the podcast, and this will be one of them. The SaniPath will be kind of an episode that will be in the library. Be sure to check out the sanitation library with SuSanA. That's where they'll be, as well as you can always access them on other platforms for podcasts. If you'd like to learn more about SaniPath, you can visit their website, www.sanipath.org. But you can also connect with Suraja and Atto directly. If you both feel comfortable, you can throw your emails in the chat so people can reach out with their questions, especially the ones that didn't get answered today. And then if anybody does have thoughts on this particular episode, if you have papers you would like us to review, or you would like to get involved with Papers to Practice, you can email myself, lkohler@cost.org, or Dorothy, which is Dorothy Spooler @eavog.ch, and we can throw those in the chat as well. And thank you, and see you next month when we actually launch this podcast. And I know we're a bit over time, but now we're going to go into a break. Thank you again, Atto and Suraja. It was really great to have you today.
Thanks for having us.
Dorothy?
Yeah, I'm here. Thank you.
Okay.
So, Thanks for this session, and thanks for everyone who joined us for this first session, this experiment, let us call it. I really enjoyed it, and I really think I've learned something which I would not have learned because I would not have read the whole paper and understood the essence of it. So thanks to Raja and Atto to taking the time, and for everyone else who just joined us now, we're gonna have a micro break of a few minutes, and then we see each other for the working group 1 meeting.
Great.
So see you soon at, let's say, 40, 50, 10 to, yeah?
Yeah, I think that works.
You're there? You're muted. Good.
Yeah.
We still have people getting into the room.
Yeah, it looks like we've got some maybe newcomers for the working group 1, which is good.
I let you manage the waiting room now, you and Finn. I think he's with us as well. And then Laura, before I start, don't forget before the breakout rooms that we maybe take a group picture people turning on their cameras? Could that be an option?
We can try. Yeah, we'll give it a shot.
Perfect. So for those that are back, it's almost time to start with the Working Group 1 meeting. For those who joined the first session are still with us, thanks for staying. And for those who just joined, thanks for joining. So this is actually the Working Group 1 meeting, and Working Group 1 is about capacity development. What we just had before is the Papers to Practice podcast series launch, using an example where two authors of a scientific publication were answered to present us the content of this paper to a broad audience. So this next 45 minutes are going to be more the classical Working Group 1 meeting, and as always, being it online or face-to-face, we're starting with a few questions to get a better understanding on who is in the room with us. So for that I think we start with, if you're motivated, you put in the number of times that you have attended a Working Group 1 meeting in the chat. I think I actually didn't count really, but it's definitely more than 10. And while you're putting these numbers into the chat, Laura, you want maybe to get up the polls.
Yes.
So who is here with us today? The first question is, which type of organization do you work for?
And just a note for the poll, we'll have to go through all the questions, and then you'll have to submit your response. So there's a series. That way, when everyone's filled it out, we'll be able to look at everyone's responses.
Okay, good.
Just a couple more minutes. We have about 50% of everyone participated, so we just need the last kind of stragglers. Okay, we're at 65%, and I feel like it's starting to taper off. Oh, no, we got some more. Okay, I'm going to end the poll. So if you have any last responses, put them in there now. And that way I can share our results. Okay, I'm going to end the poll now. And I'm sharing the results. Go ahead, Dorothy.
I can't see them.
Okay, so in terms of, I'll kind of go through what I'm seeing. So which type of organization do you work for? We've got quite a mix here from multilateral agencies, government, quite a few international NGOs and academia, as well as private sector. So I think we've got, again, a mix of government as well. In terms of why are you interested in Working Group 1? Quite a few people said knowledge management and sharing, learning exchange. But again, there's a spread across communication, coordination, and research, which is great advocacy as well. and a couple others, which is just to capture, you know, the ones that we didn't put up there. In terms of which meal did you just eat? Most people just ate lunch, which is great. A couple people are early in their day, breakfast, and a couple are a bit later. Hold on. And then lastly, how many hours a day do you spend online or on a Zoom call? Most people, it looks like we've got some good time management. People are spending probably 1 to 2. The majority are in that 1 to 2 or 1 to 5 range. And there's a couple people who have just lost count. It's gotten to the high numbers or all day long. So they are, constantly online. So that is just a bit about who's here today.
Great. Thank you, Laura. So with this, I'm gonna start the meeting as always with a short introduction about SuSanA and the Working Group 1. And I think it's important for those that have been at the meeting before, just do something else for a couple of minutes. And there are many people that are here for the first time. So I think it's relevant to have this introduction. So the aim of the objective is to give you an introduction on SuSanA and this working group. And I'm also gonna introduce the launch of a new working group, fact sheets on capacity development. And I see that some people, like for instance, Sandra, who worked with me on this, are with us. And I will also share another product of SuSanA, and we will have at the end a more interactive breakout room session. So how did it all start? It's almost 50 years ago. In January 2007, there was the kickoff meeting in Germany, and it was initially meant to prepare and align for the International Year of Sanitation in 2008. So, but that was the foundation of the Sustainable Sanitation Alliance, and there were several motivations. I picked up 2, which I think is relevant. One motivation is that sanitation is crucial for wash as much as water supply. And sanitation is not only about toilet infrastructure, but requires the consideration of the entire sanitation value chain, as well as the software aspects and the enabling environment. So these and other motivations and the goal of SuSanA have been agreed on by all members and partners in a vision document, which was rewritten or adjusted in 2017 to reflect the updates of the SDGs evolving from the MDGs. And there's one main element which is very important and central, I think, for not only for SuSanA, but also its impact in the sector. And that was the definition of the 5 sustainability criteria. So a sustainable sanitation system protects the health and hygiene, protects also environmental and natural resources, provides appropriate technology and operation maintenance, considers financial and economic issues, and social, cultural, and institutional aspects. So there were 2 unique selling propositions, which I think were very new in the sector and helped SuSanA to gain some visibility. One is that there was really a broad range of experts and knowledge accumulating in a neutral platform, and that there were systems promoted which were not really relying on sewer system, and thus more appropriate for many areas in the developing world. And that there was knowledge and expertise about systems that allow for closing nutrient, water, and energy cycles. And these important elements then actually have been taken up and recognized in 2015 by the SDGs. And I think there SuSanA really had a kind of a early how do we call it, a promoting role. So to cover the motivations and the aspects of sustainable sanitation, 11 working groups have been established in order to cover all relevant aspects that are required for sustainable sanitation. And one of these working groups is our working group, the one on capacity development. And now these are numbers from 2017, but from a few experts and organizations, the network has grown to more than 7,000 individual members and 300 partner organizations. And I'm sure today, to 2021, there are even more. So SuSanA has mainly today 4 roles. It's a coordination and discussion platform. SuSanA is a sounding board. There are a lot of publications and tools that have been made possible through the collaboration of different SuSanA members. And I've highlighted 3 here because these are from EAWAG, the organization I'm working for. And I'm shortly introduce another upcoming tool that we are currently working on. Another important role of SuSanA is that it contributes to the policy dialogue through fact sheets like the fact sheet on capacity development, but also other resource materials that can be found on the library. And of course, SuSanA is a working platform. So these different working groups allow exactly to link together and have a neutral platform to start developing projects that are relevant for the sector, products that are relevant for the sector. So why a working group on capacity development? So sustainable sanitation, and that's a complex picture here with all the working group illustrates it very well. Sustainable sanitation requires a multi-sectoral and multi-professional approach. And it's not just business as usual, but it requires both technical know-how and an enabling environment. And besides the capital investments required to reach SDG, we also have to close the capacity gap. So IWA, for instance, estimated that there should be 1 million sanitation professionals trained per year. So why a working group? Why are we here? And what is capacity development? Capacity development, according to the UNDP, is the process through which individuals, organizations, and societies obtain, strengthen, and maintain the capabilities to set and achieve their own development objectives over time. And another similar definition, capacity development is the process whereby people, organizations, and society as a whole unleash, strengthen, create, adapt, and maintain capacity over time. And capacity is not just about training of individuals, but capacity development has to address different levels. This includes to increase abilities of individuals, to enable organizations to develop collaboration platforms as SuSanA, or to create an enabling environment and establish a system for sanitation. So whose capacity is being developed at different levels, the individual, organization, network, and system level. There are different actors to address, so it's really not just about one actor. And capacity for sustainable sanitation has to be transdisciplinary, so including practitioners, academia, policy, and decision makers, and citizens. And it has to be interdisciplinary, including technology, planning, finance, health and hygiene, monitoring, and evaluation. So all these aspects are covered actually in the Working Group 1 meeting, Working Group 1 new fact sheets. And you will also find in this fact sheet a list of possible capacity development interventions. And it's really not just about training, but it's about education and training, knowledge management and sharing, coaching and mentoring, research and documentation, organizational development, partnership and network development, and advocacy. And when designing capacity development intervention, different types of learning have to be considered. So one example for the effectiveness of capacity development, which we also integrated in the new fact sheet, is the capacity development effectiveness ladder that has been developed by the capacity building platform SCBP in India, and it shows that it has to go from developing content until the visioning change and to really have a contribution to capacity development. So all this You can read more about it in our Working Group 1 fact sheets, which we launched yesterday. The first version was launched in 2009, and we are now on the newest version of 2021. And we have over 14 members of the Working Group who contributed, provided information or helped in proofreading. And you can have a look at it in the forum and give us your comments or suggestions for it, or share it with your network. So what are the objectives of our working group? So we have 6 objectives, and they cover what we believe is relevant for capacity development for sustainable sanitation. And it goes from knowledge management and sharing until advocacy, and that's what I just mentioned. And how do we work as a working group currently? We have people that are interested in what is capacity development, and others that are just interested in why and how, or are looking out for resources they can use for their capacity development. So we are focal point, networking opportunity for anyone or any organization who seeks to become active in capacity development. We do information sharing, and we have these regional meetings or online discussions. So if you have anything that you think is relevant to share with others of the working group, you can always reach out to us or use the forum or the mailing list for that. So I mentioned before, there are some relevant sustainable sanitation capacity development products that were made possible through SuSanA, and this includes the forum, which you will find on forum.susana.info. And there you can always start a discussion if you have a topic that you think we should discuss as a working group. How do we communicate? Here again, you have the link to the forum, the Working Group 1 email list, which you can use to reach out to people, to all members of the working group, and you have the personal emails of me and Laura, but any of the members of the group can take over entirely or partly the responsibility for any work on a specific activity. So it's an informal network, and it's meant as a working platform. Yeah, SuSanA future. So in the past, it has continuously adapted to most up-to-date challenges. So from the MDGs to the SDGs, then there was the Reinvent the Toilet Challenge, and a lot of discussion that was created on the discussion forum about technology innovations. We have built the regional chapters, and we are now really a vibrant community of a lot of organizations and individuals. And we're currently going through a change management process, and people that are interested in help shaping the future of SuSanA, you can join the session on Friday, where this change management process is going to be presented, and you have the possibility to interact. And with that, yeah, for those that are new to us, join us. And I see there is some activity in the chat. Laura, I don't know if there's any question about SuSanA that we should try and answer at that point.
No, there weren't any questions. There are some good comments. So I encourage people to kind of go back and there's some contributions there about, new definitions on capacity development. And again, contributions about capacity development can start with local production. So yeah, feel free to continue those discussions in the chat, but we'll also be doing breakout sessions here shortly where you can share in person. I don't know if there are any questions, but if you do have questions, throw them in the chat and we can answer, but otherwise maybe we can just move into the next piece. Yeah.
That's also me today. Let me see. Can you see my screen?
No, not yet.
Mm-hmm. And now?
Yes.
Perfect.
Actually, Dorothy, if you go up to the top, you're going to have to flip your screens. We're seeing your notes, just so you know. There we go. Perfect.
So yeah, I mentioned there a different wait, I have to swap my camera, otherwise you don't see me. Perfect. Can you see me now as well? Good. So I mentioned a few important SuSanA products for capacity development in my previous presentation, and the one which we also presented before is the Papers to Practice podcast series. And now I have the pleasure to introduce another SuSanA capacity development product, which I have the privilege to develop at EAWAG based on past SuSanA products, which include, for instance, the Compendium. So the name is SaniChoice, and it stands for Sanitation Technology and System Choice for Urban Planning. And I mentioned before, sustainable sanitation, it's not only about hardware, although SaniChoice is designed to provide hardware solution as an input into strategic planning, but it's also about enabling environment and the services along the sanitation value chain. So, but there are still many projects worldwide that actually use a top-down, one-size-fits-all master planning approach, and this can lead to the provision of inappropriate technologies that do not fit the specific local conditions and the human and physical resources available for operation maintenance. And the situation is particularly challenging in developing urban areas where most of the current population growth is taking place because of high density, a lack of human and financial resources, a lack of water or energy, and a lack of resources for service provision in general. So I've mentioned also the Reinvent the Toilet challenges. Many also members of SuSanA have been investing in the development of novel technologies such as urine diversion toilets or novel sanitation systems such as container-based sanitation. And these innovations promise to be more appropriate to the context of developing urban areas because they're independent from sewer, water, or energy supply, require little space, but they also promise to be more sustainable because they allow for resource recovery and reuse, and they're more flexible to changing environmental or socio-cultural conditions. So already a long time ago, it has been recognized that strategic planning for sustainable sanitation has to be an approach which considers not only technical aspects, but also multiple stakeholders and specific local conditions to provide technologies that are locally appropriate in terms of technical, physical, demographic, social, cultural, legal, or financial conditions. And this has been documented in the publication of GIZ, where I also had the pleasure to contribute, which documents many of strategic sanitation approaches that should help to provide more sustainable sanitation. And one of the most recent approach, which is currently being talked of a lot, is citywide inclusive sanitation, CIWS. So CIWS, I think it's interesting for SuSanA because it has been defined jointly by a broad alliance of actors, including SuSanA Working Group 6. And there are a number of principles, and these include, for instance, specifically the consideration of the entire service chain from containment to the final reuse or disposal, and the consideration of various types of sewered and non-sewered systems, and the need for an evidence-based selection of the locally most appropriate options. And they also include the need for considering stakeholder preferences. So, but identifying a locally appropriate sanitation system is actually a complex decision-making problem that involves the growing number of technology options, multiple sustainable criteria, and various stakeholder preferences.
So what technologies to consider in a planning process? How compatible are these innovations with each other? And how can they be assembled into entire sanitation systems? And which of these systems is the most appropriate in a given context, and which is the most sustainable? So these are questions I've been dealing with a lot in the past. And there are also a number of existing structured decision-making frameworks like CLUES or Sanitation 21 that came out of SuSanA that actually allow for more evidence-based decision-making and involving multiple stakeholders and criteria. And there are a number of tools that help to operationalize these approaches, including SaniPath, digital flow diagrams, or the criteria for sustainable sanitation. But the identification of a certain technology planning option is left over to engineers, and they're most often overwhelmed and don't have knowledge or data to include all these different promising innovations in the planning process. So we think that there is a lack of tools that are able to consider the entire diversity of novel and conventional technologies and systems, and that are able to compare resource recovery potentials of different systems at a very early planning phase. So that's why we have developed SaniJoys, and it's based on previous experiences. I mentioned the compendium. So this combines a large amount of expert knowledge in an easily accessible format. It also systemizes how sanitation systems can be designed. And there is the emergency sanitation compendium. This is online, so it's more easily accessible, and it's also more easily navigable, and it's flexible to include novel technologies continuously. I mentioned CLUES, and one software which we have been developed in and launched last year at EAWAG is Santiago, which allows a more transparent and evidence-based evaluation of local appropriateness of different options. It enforces the consideration of the entire sanitation systems, and it also allows to quantify resource recovery potential as one possible evaluation criteria in the process. So why do we need a software? There are different reasons, but one reason is that there is really a lot of different options. So if you would only consider 6 innovations per functional group of a sanitation system from U to D, the user interface to the reuse or disposal, we would already end up with 8,000 possible systems, and no expert in the world is able to go through these systems and evaluate those for a planning process. So that's why we have developed Santiago, and it contains a technology library that compiles a huge amount of expert data and knowledge, the different algorithms, and the step-by-step guide how to get the input from the planning process. So this is nice, and we've developed in a design thinking approach with many partners from the field. There are different publications and case studies available, but it's not really accessible to a broad audience and the target audience that we have here as a working group. So that's why we decided to go from software to a tool, and we started with a number of interviews to develop so-called personas, so fictive but realistic representation of the key audience of the software. And we decided to make a web-based interactive tool that should cover different design considerations. So it should be able to cover the entire range of conventional and novel technologies. It should be flexible to be applicable anywhere and for any novel technology also in the future. It should look at entire systems. It should allow to streamline the planning process so the expert can get down to a number of options he's able to deal with. It should still be transparent and no black box. It should be allowed to consider really the specific local conditions with the data available at the early planning process, by also providing some evidence and data from international literature to compare to. And it should be easy to use and allowed to share the results with stakeholders of a given person using this tool. So this tool, that's what we're now currently developing, and it's soon going to be online on the SuSanA server. And it will be an open source free capacity development and decision support tool for practitioners, having to deal with strategic sanitation planning and having to deal with the identification of possible sanitation technologies and systems. So it will allow to systematically compare the appropriateness of sanitation technologies for a given case at hand. It should allow to build valid sanitation value chains. It should allow to pre-select a set of options that is of manageable size to consider together with stakeholders. And it should allow to share or save the results in workshops and reports. These are the 4 main services. It has 3 main chapters. One is about the technologies and the technology appropriateness filter. There is an overview on system templates and the possibility to pre-select some types of systems like black water or urine diversion, or systems focusing on biofuel recovery. And there is a dashboard to compare selected systems. So it has a few other contents like on how to use a training package, a library, and the glossary. And it will look a little bit like that. So we will provide an overview of all possible sanitation technologies, as well as a simple possibility to prioritize or remove technologies. So in the case you have to deal with a situation where part of the sanitation value chain is already constructed and you have to live with it and adapt to it. And there will be a simple set of simple pre-selection criteria to further boil down the number of technologies. So for instance, you would have the desired input or output products, or you have the development phase. So we really try to link the humanitarian context with the development context. So there is a more advanced filter. I mentioned it. We have currently different criteria, and to enter your data, you can load examples, and then it will be easier to just adapt this data from the examples than fill in something empty. We have currently 27 criteria from different types, like covering, for instance, water supply or water volume, or the skills available for management. And you can always adapt the data. I mentioned that you can remove criteria or you can add criteria, and you can always save the results and share them with partners, or load them again later to work on it. Or you can go directly and generate possible systems and move on. So you will get a ranked list of the technologies, how appropriate they are, and you can again remove or prioritize. You can always click on this exit button if you're totally overwhelmed, or you can click on an appropriateness score to understand where this actually come from, and now you might be able to finally work and adapt your data. Yeah, you will have this dashboard where you can compare different systems regarding appropriateness, resource recovery, or additional evaluation criteria. And you can also always go back to the filter, adjust data, or you can go to a detailed comparison where you can look at some criteria which are particularly important for you. By clicking on a system, you get more details on the systems and the technology contained in it, or you can change your dimensions or add a third dimension, for instance, losses to environment, to have a more detailed assessment. So there are a number of advantages we think that Santiago brings. So this includes the large diversity of different technologies and systems, the data that is available for more evidence choice, the interaction, so people can really also provide their local conditions and have a look at the results. Uncertainties can be considered, so you can really just give very rough estimation what you know about your place. It's flexible, so any technology in the future can be included, and it helps experts to really think out of the box and come up with options which they don't know about and which are potentially more appropriate or sustainable. And the results and information are really easy to extract and share. So yeah, there are 3 use cases for planning decision making, for training the capacity development, or just for awareness raising, highlighting the potential advantages of different technologies and systems. And it's going to be launched in October 21. And we are very interested, and that's why I'm talking about this today, to get your feedback and have you as a test user. And for that, you can contact me by email. Good. And I think I don't want to take time now for questions now, because we have a more interactive session. We're already a little bit behind schedule. And I hope, can you see me here? I hope people are still with us. So if that's okay with all of you, you can write me an email if you have questions to that. But also, if you have similar tools or examples of capacity development and products or resources that you think you should also share them with us in such a meeting or on the forum, post them in the chat, or really have an announcement on the forum that we as a sounding board can give you feedback. And I really hope that you will also be my sounding board for this choice tool. So Laura, I'm gonna share screen, and you maybe want to introduce the breakout rooms, or should I do that?
Why don't you go ahead and introduce the breakout rooms? I can get them set up.
Good. But I need a few seconds to get up the questions.
And we are given the time. How long should we do for the breakout rooms?
So I think we can have 15 minutes.
So we'll go over slightly time-wise.
Yeah, I think that's fine, and people can drop off. But before we go into these rooms, what do you see now? The presentation now, the other?
Yep.
Good. So we can, so maybe I introduce the breakout rooms, and then people can drop off or stay. But before that, shouldn't we take this picture?
Oh, sure, let's give it a shot. So for those that are remaining, if you are able to turn on your camera, and we'll go to gallery view. We always try to do this every working group 1 meeting. Always a bit trickier on Zoom. So what I'm gonna have everyone do is, for those that have put on your cameras, you're gonna have to hold for at least a couple seconds. So as I take both, do a screenshot.
The question is if our screen is not big, but I let you do it, and then
there's 2, so it'll be under 2 photos. So we'll just have to add, we'll combine them. So give everyone a couple more minutes. Not everyone's turning on the camera, which is fair. Yesterday I had to keep my camera off just because of connection. So, but I'll try to get as many people on as possible.
So I see Vishwanath and I both have shaved.
Okay, so we've got a number of people. Right, so what I'm going to do is I'm going to do some screenshots. So everybody smile. And give me 1 second. I'm going to do one more. Hold on. Okay, one more. And I think, let me just give me 1 second. Yep, that's everyone. So thanks everyone for turning on your cameras. We got at least a number of you for our virtual working group 1 meeting. Okay, you can, if you feel comfortable, or you can keep them on or turn them off as you like.
good. So this last session should wake you up for the rest of the afternoon, and we're gonna put you in 6 different breakout rooms. Laura, if you could post a link to the Miro board in the chat, that would be great. So we have prepared 3 questions which we thought would be interesting to discuss in smaller groups, also to know to get to know each other. And these 3 questions are related to capacity development and the COVID-19 pandemic. So the first one is about business travel. The second one is about capacity development under the pandemic. And the third one is what we can learn for the future and how can we take out the best of it. So you're going to be in a room with other people, and there's not time to look at all these 3 questions. So what I suggest is that you look that you pick together one question and you just have a discussion around the topic. There is this Miro board where you can drop some comments, but you can always also just talk together and have an exchange on these topics. And after 10 minutes, I will close the rooms. You're either still here and then we can say goodbye and see you soon, or you leave and see you maybe at 4 o'clock for the next session or any other SuSanA meeting.
So I'm putting the link in the chat, but I do need people to test it. Dorothy, I may not have the best link. Can you check to see if that is correct? And if not, can you please put it in? And there is a password.
Password is SuSanA working group 1, WG1.
Did that link work?
No.
Can you put it in? I have, because it was in a message, so I don't have the. And in the meantime, I'll get the breakout rooms ready.
And here we are.
Okay. So everyone click the link before you. So the first one won't work. Use the second link that's posted by Dorothy. And I'm going to open the breakout room. So please click the link before you head to your room, and we'll pull you out in about 10 minutes.
No.
I think we are at time. So I think everyone's come back into the room. Dorothy, do you want to kind of wrap it up and we'll just.
Well, we were caught in our discussion, too little time to
Sorry.
exchange. I really hope we can meet physically again. And we didn't have the possibility to really dive into the topic. I think there are two things which came up. The one is the additional efforts required for organizing capacity development intervention when you really have to rely on face-to-face meetings. And I think the experience from Prasanna, who shared with us that they actually combined the capacity development with the vaccination campaign of the participants to be able to have them together and train them properly on something that has to be trained because it involves manual work. I think that's a very interesting point, which I have not thought about, but that could be maybe an interesting approach to have vaccination as part of the capacity development, given people want to vaccinate.
Mm-hmm.
Another big topic, I think. I can share also, I think for MEAWAG, what we've learned is that hybrid capacity development is very, very difficult. So having people online, half face-to-face, it's very difficult to interact, and because the formats have to be very, very different. And one thing we hope to be able to invest in is developing the parts that can be developed online through videos, through whatever, to do that and to be able then to concentrate on everything else that has to happen with personal interaction. I don't know if others want to share.
I think we're over time, so maybe one of the things is this is obviously an ongoing conversation, and it would be, like you said, great to have everyone in person to discuss these and share these different tactics further. But the forum does exist, and I think one of the things you could do is open a post on the forum to continue this sharing, and especially those groups that had, in the limited time available, had some, you know, great discussions. You can share your contributions there. I think that's everything for this session. Again, reach out to Dorothy and I. And Dorothy explained it very clearly that we're not the gatekeepers of Working Group 1. I think our role is to keep it alive, and you know, it's all volunteer basis. So please use the group as a way to kind of further your own interventions and work. And if you have ideas, reach out to us.
Yeah, and what I'm really personally interested in, I think maybe some others as well, is to learn from you. How would you see our future interaction working group meetings? Because there is the point that, of course, we're gonna have other people online than face to face, and I think that there is also advantage in it. So how do we optimally combine different formats? If you have thoughts or wishes regarding this topic, I'm very interested to learn.
Okay. Thank you, everyone.
Yeah. See you
Dorothy,
soon.
Dorothy,
Yeah.
could you put your email address again in the chat so we can
Sure.
have it?
Mhm.
Would be nice. Thank you.
Great. Okay. I'll wait for you to put that in, and then I will end the meeting.
Thank you. Take care, everyone. Bye-bye.
Bye, everyone. Bye.
Bye.
Thank you.